Bigla na lang nagbago ang lahat. Madami nang naghihirap. Kakayanin pa ba ang hinaharap? Paano na ang ating mga pangarap? Kailan ang araw na babalik ang sarap? Sabi nila, naghihilom daw ang mundo. Nakakatakot, nakaka-nervyos. Handa na ba tayo sa hamon ng mundo?
Chinese authorities say they're investigating a viral pneumonia
quarantine of the entire region of Peninsula.
More than 400 new COVID-19 cases, as well as 7 new deaths. There are now 3,660 cases in the country, with 163 deaths.
Good day everyone, I am Regine Carino from BC 3A Horticulture. For today's video, I will be showing you the effect of pandemic featuring different ethical values and issues. And here are some of the ethical issues that has been affected by the pandemic. Ethical issues related to COVID-19 pandemic in patients with cancer. COVID-19 pandemic, first identified in 2019 in China, has been spread around the world within just few weeks, indifferent to borders and human construction. Almost each country has to face the outbreak of this new epidemic, which lead to hospitals, emergency rooms, and intensive care unit (ICUs) being overwhelmed, and sometimes death of several hundreds of people. While the virus blindly struck entire population, it fell more aggressively on the most vulnerable, such as the elderly and patients with severe chronic conditions, hypertension, obesity, diabetes, respiratory insufficiency, and cancer. The COVID-19 pandemic has aggressively reached the most vulnerable, not only the elderly but also patients with chronic conditions such as cancer. In this vlog, I will represent the outlines of ethical thinking and the measures implemented to try to respect our basic values of care in the specific environment of an oncology hospital. Facing challenges of a unique kind and dimension for most of our generation, we present the outlines of ethical thinking and the measures implemented to try to respect our basic values of care. In the specific environment of an oncology hospital, by its daily involvement in medical decisions, the common thread of our ethics committee was the attempt to protect, whenever possible, the principle of the deontological ethics by strictly resisting utilitarian pressure. I will discuss the challenges faced by patients with cancer during the pandemic, such as access to critical care and ethical dilemmas in the context of resource scarcity, as well as the issue of isolations of patients. We also debate the restriction in access to oncology care in health context is strongly prioritized against COVID-19. In all areas of an ethical dilemma, either for sorting out access to critical care of the dramatic consequences of prolonged isolations of patients. Our common thread was our attempt to protect, whenever possible, the principle of deontological ethics by strictly resisting utilitarian pressure. Respecting democratic health decision-making process is cornerstone of ethically relevant decisions, including in the context of sanitary crisis. The role of an ethics committee related to real-life situations include not only a reflexive perspective in respect of fundamental principles, but also the help to enlighten and resolve ethical dilemmas in complex clinical situations. This ethical watch team assists physicians in decision-making, promoting the supportive and palliative dimension of care with a holistic approach. Alam naman natin na it's hard to stay positive these days. Pag tumingin ka sa cellphone mo, pag binuksan mo yung TV, pag tumingin ka sa newspaper, it's all about the news about COVID-19. Sobrang nakakatakot, di ba? Ang pinaka-worst pa nga, di ba, we are arguing to enforce to minimize the risk of spreading the coronavirus. So, napakahirap sa mga tao na mag-adjust ngayon sa ating nakasanayan. Kasi nga, dati, free tayong lumabas, walang face mask, walang face shield. Hindi kagaya ngayon na nakakulong tayo sa bahay, hindi alam yung gagawin. Nagpapanik kung anong dapat gawin para hindi mahawaan ng coronavirus. Kasi yung coronavirus, ang bilis niyang kumalat sa mga tao. Ang daming naapektuhan, ang daming namatay. Kaya ang mga tao nagpapanik buying sila. Katulad ng pagbili ng mga alcohol, gamot, nag-uubusan ng mga stock sa mga groceries. This is also an opportunity to take an introspective, to look at yourself, to think about your most value, to consider how will you live a meaningful life. Ethical living is always a joint endeavor. It's all about how we live together, how we interact with people, how we draw out the best of humanity in one another. Social connection is the vehicle and the fuel for living ethically. It's how we learn and grow, and where the fruits of our learning and growth are realized. This pandemic has provided an opportunity to appreciate our common vulnerability and better realize the importance of working in concert to face a disease that poses a significant threat to our country and to civilizations around the world. A critical ingredient for resisting this pandemic is to recognize our reliance on one another and to support every person's efforts to live responsibly. These rules have forced us to stop and think about what they can do for the common good. We have a unique chance to recognize the important role we play in our world and think about how we can take care of each other. We must not squander it. Because ethical societies can't hold physical gatherings for the foreseeable future. It's an interactive forum called Connections. As the coronavirus pandemic continues, we must focus on the beams of light shining through the clouds. Better yet, we must work to be the light. Humanity has always been intrinsically connected. But now, we're seeing those connections on a global scale. These times may feel dark and unpredictable, but one thing is certain, we will emerge stronger if we focus on and nourish the interconnectivity that makes us human.